Ever wondered how research helps nurses make better decisions? Well, today we're breaking it down in the simplest way possible so you'll never mix up primary and secondary research again. So, what is primary research? It's when you collect new data yourself. Think about it like this. You're a nurse in the ER and you notice that patients who listen to music before a procedure seem calmer. You decide to measure their stress levels before and after music therapy. Since you're gathering new data, that's primary research. Other examples of primary research in nursing include conducting surveys on nurse burnout, running a clinical trial to test a new wound dressing, interviewing patients about their pain management preferences. It takes time and effort, but primary research gives you brand new information that can improve patient care. Now, secondary research is different. Instead of collecting new data, you're analyzing studies that already exist. Let's say your hospital wants to reduce nurse burnout. Instead of running a new study, you review research articles that analyze mindfulness techniques for stress management. Since you're using existing research, that's secondary research. Other examples of secondary research in nursing include reading a systematic review on infection control, analyzing data from past studies to develop care guidelines, reviewing a meta-analysis on pain management. Secondary research is faster than primary research and helps you see the bigger picture. Primary versus secondary research. What's the difference? Think of it this way. Primary research is like cooking a meal from scratch. You experiment and create something new. Secondary research is like reading a recipe book. You learn from others' experiences to see what works best. Both are important in nursing research and help drive evidence-based practice. Why should you care about primary versus secondary research? Because research is the foundation of evidence-based practice, EBP, which means safer, more effective patient care. Imagine your hospital is debating whether to switch from 12-hour shifts to 8-hour shifts to prevent nurse burnout. For primary research, you'd conduct a study to see if nurses on 8-hour shifts report less fatigue. For secondary research, you'd review past studies to see if shorter shifts improve well-being. Using both types of research helps hospitals make informed decisions that benefit both nurses and patients. What if you are searching for existing published studies for a project? How do you identify primary versus secondary research? Here's a simple trick to quickly tell the difference. Did the researchers collect their own data? If so, it is primary research. Or did the researcher summarize multiple studies? If so, it is secondary research. Still not sure? Let's look deeper. A nurse wants to know if mindfulness training reduces chronic pain and found 2 studies. Look at 2 studies for clues. In the first study, you can see clinical trial report written at the top, which is primary research since a clinical trial is a type of quantitative research design. Clues can also be found in the title of the article. For example, this article mentioned the development of something new, which is often primary research. For better understanding, it is best to read the study's abstract. Since they surveyed patients, it is primary research. In the second study, you can see review article written at the top, which is secondary research, since a review is done from analyzing multiple studies. Clues can also be found in the title of the article. For example, this article provided clues of the secondary research designs as systematic review and meta-analysis. For better understanding, let's look at the study's abstract. Since they analyze multiple existing studies, it is secondary research. That was not too bad, kind of easy, right? So now that you can identify primary and secondary research, when should you use each type? Here are some general examples. You can use primary research when you need first-hand data for a specific problem at work, are testing a new nursing intervention or treatment, are looking to answer an interventional PICO question, are conducting a quality improvement project. need only primary research for a school assignment. You can use secondary research when you need to quickly find evidence on a topic, are writing a literature review for school or research, need strong level 1 evidence for practice guidelines. Each type of study has its place, and both help improve nursing practice. Let's see what you've learned. Think fast. What's the right answer? Question 1. A study surveys 300 nurses about burnout. Is this primary or secondary research? Primary, it collects new data. Question 2. A systematic review analyzes 15 studies on patient falls. Is this primary or secondary research? Secondary, it's summarizing past research. Question 3. Which research type is best for quickly finding existing evidence? Secondary research. Question 4. Which research type is best for answering an interventional PICO question? Primary research. Question 5. Can you use a combination of primary and secondary research as evidence in your research projects? Yes, of course you can. Did you get them all right? If so, great job. So now you know the difference between primary and secondary research and why both matter in evidence-based nursing. Understanding the difference helps you improve patient care, make informed decisions, and advance nursing practice. Next time you're reading a research article, you'll be able to spot the difference instantly. Want to learn more about nursing research and evidence-based practice? Check out my playlist for more videos. Thanks for watching. If you found this video helpful, subscribe to the channel for more nursing education content.